President Jimmy Carter is now recovering from surgery to relieve pressure on his brain. He's under observation at Emory University Hospital in Atlanta. The Carter Center said in a statement that there were no complications with the surgery. The bleeding was the result of two recent falls that he had in October, so last month. Joining me now to explain the surgery and what is next for President Carter is neurosurgeon Stephen Scibelli with Memorial Hospital. Good morning. Thank you for being here.
Thank you for having me again.
So, two recent falls is... Typically when that happens, should there be some kind of, scan done of the brain to see if there were any ramifications as a result of that fall? Or is this kind of typical that maybe it's something that, is kind of missed?
Well, so it depends on what the patient presented like. So I suspect President Carter gets a few more scans than the average man.
I would think so.
His health care is probably pretty good, and he's taking great care of himself. But certainly when an elderly person has a fall, hits their head, has an abrasion on their head, as President Carter has had, it's worth taking a look at their head.
So that said, the surgery itself, and I know that we have some video of surgery similar to this, is it complicated? What is that process then of relieving this pressure on the brain?
So there's several different types of surgical intervention for this. Essentially, your skull's a closed space. In there you have your brain. It's covered by this kind of white leathery material called dura mater. Inside there you have your brain, cerebral spinal fluid, which is a clear fluid your brain and spine sit in, and blood vessels. So anything that takes up extra space, your brain has to give some space. So if you have a bleed and it compresses your brain, that's what gives away some of the space. So you have these little bridging veins going from the brain to that white leathery material, the dura mater. And as we age, just like our muscles atrophy, our brain atrophies, so it shrinks. So now these little vessels, just like my tie, get put on stretch. And so you can have a fall, you can have an abrupt coming to a stop at a stoplight. Sometimes you can even have a cough and tear these little veins. And so when you have these events, it's important to be seen by a medical professional, go to your local ER, see your local doctor, things along those lines.
Whenever we hear about brain bleed, I think a lot of us assume, oh no, there's going to be long-term ramifications as a result. Is that always the case? I mean, can we expect that his prognosis, he's going to be back out there, working for Habitat for Humanity as we saw after his last fall?
Well, again, President Carter's a special man, right?
It is amazing what he's been through and recovered from.
With a hammer and nails. So I suspect that he'll have a good opportunity for the best recovery possible. But certainly we can expect a person to go back to normal life depending on what the injury was. So as I failed to answer your question a little earlier, the types of interventions, you might have just a little hole drilled in the head and a scope put in, a little drain to take out the blood. You might have to have two holes put and we kind of flush the blood out from one to the other. Or even if it's larger or more dramatic, we take the whole side of the skull off or even both sides of the skull off, clean out the blood and put that back on. So the recovery period is largely based on what kind of permanent or at least temporary now deficits the president will have. If he has no deficits, he'll probably have a quicker recovery. Certainly getting up and recovering at 95 is different than recovering at 35. But his constitutional and the way he's taking care of himself is remarkable.
He looks fantastic.
So
he's very
I would certainly bet on the president.
And quickly, warning signs. We all have aging parents. My father has fallen probably 4 or 5 times in the last couple of months. It scares me to death, sometimes leaving him by himself. What are the warning signs of a brain bleed that means going to see not the internal medicine doctor, but maybe a neurosurgeon?
So if he has any signs similar to what you might think of as a stroke, if he's got weakness, slurred speech, visual field deficits, things along those lines, changes in sensation in his body, those are all things that should warrant an immediate evaluation. But again, as you intimated to earlier, there's a chance that you might have a bleed in an elderly person that's not appreciated initially. They may have a small bleed that becomes a chronic one. The blood doesn't continue to bleed, but as it breaks down those blood products inside your head, it can draw water in, it can take more space up, so you can have a chronic subdural. It's possible that the president had one of these, because he's had several falls this year, and they didn't rush him to emergency surgery, as I recall from the reports. Right. So he may have had an expanding chronic subdural that they then addressed in a controlled fashion the next day.
We certainly hope that he recovers quickly. Thank you, doctor, for being here. Do appreciate it.